Hey guys, what's up? Caleb and Jake here from Peak Strength and Fitness, home of CrossFit Gwinnett. I'm talking today. Jake's had his wisdom teeth pulled out, so talking's not an option, all right? So what we're going to cover today on Technique Tuesday is we want to talk about your thoracic spine, what it means for you, okay? So first off, your thoracic spine is the area of your back. If you turn around, right in the back of your shoulders and your chest, right through here, okay, it runs down the top part of your spine. That's where it's at, okay? It has a potential to be super flexible. It's responsible. It should be able to rotate independent of your hips. Should be able to flex and extend, do all kind of movement and stuff. Most of the time, we lose that range of motion through the positions we're in throughout the day. We're like sitting at our desk. We end up having bad posture, but we lose the range of motion through that thoracic spine, that T-spine. So there's a couple ways that we need to be able to get that range of motion back, okay? Without that range of motion, when Jake puts his hands over his head, we're overhead lifting, we're going all throughout life. When he tries to go overhead and he lacks range of motion, he's going to do one of two things. He's going to compensate, and he's going to throw his hips forwards and try to lean back as his shoulders won't open up. All right, that's putting a lot of stress on his back. It's putting his shoulders in a terrible position. Other option he has is he's going to try to torque his shoulders way back to get that bar back where it needs to, and that pulls his scapula, his shoulder blades, back. Right? When he does that, there's nothing underneath him for support. There's no support underneath there, so that inevitably is going to lead to a shoulder injury. So we need to have proper range of motion and flexibility through his T-spine, be able to hit good positions, let us get strong, and to keep us safe. Okay? So our homework, what we're going to work on is being able to loosen all this stuff up, get that range of motion through your thoracic spine back. So there's a couple things we're going to have you work on. Okay? Number one, you're going to grab your lacrosse ball. Okay? If you have one or two, if you have the peanut with two of them blocked together, that's great. All right, if not, you just have one. You're going to lay on that lacrosse ball. We're going to stay off of the bone, but you can hit anything that's muscle and connective tissue. So right between your scapula and your spine, all that tissue through there, you're going to lay on there. And as Jake lays on that ball, he's going to do a couple things. He's going to give himself a little hug for doing this, right? And while he does that, he's going to work his way back and forth. He's going to start scraping that muscle back there. And he's also going to hit flexion and extension. So he's going to start opening up. He's going to try to think about pushing his chest up and arching his back on top of that ball. And then he's going to pull it up. He's going to work on getting some range of motion back in that thoracic spine, okay? So this one's not super comfortable, but it's really effective. You can also hit the same thing with your foam roller. Okay, get that foam roller back there. You're going to lay on that. You're going to roll that whole area out. Same thing, while you're getting up in there, get your hips up off the ground, get some pressure in there. Drive your hips up, and you can hit that flexion and extension in your thoracic spine there too. Okay, this is going to help loosen that tissue up, give you some of that range of motion back where it needs to be. That's going to help you stay safe when you're lifting overhead, when you're doing a bunch of other things. All right, and we also have a drill that's going to incorporate our diaphragm breathing. Jake's going to get on his knees and his hands. He's going to make sure he's locked in. He's going to work on breathing into his diaphragm and be embraced. When he inhales, he's going to go ahead and round his back. He's going to think about pushing his belly button to the ceiling. Okay? And then as he exhales, he's going to come down and go the opposite direction. So as he breathes out, breathes that air out of his stomach, he's going to come down and arch his back. Okay? So you're going to inhale and round, exhale, and arch. Okay? This cat and camel will also work on giving you some of that flexion and extension back that we need. Okay? The last thing we want to talk about real quick is when you're lifting. So we can take these movements and apply them to when we're lifting stuff over your head, whether you're in a handstand push-up, when you're doing a press, or a kettlebell, or a barbell, you're doing a snatch, or a jerk. Anytime you have something over your head, what we want you to think about, especially as you're warming up, is the position that we just talked about. Make sure you're opening up. We want to make sure you're stacked in a straight line all the way down. So if Jake has a bar over his head, what we want to see is a straight line from his wrist all the way down his body. So he's stacked everything on top of each other. The big thing we want you to think about that's going to help you maintain this position is pulling your rib cage down. All right? So stay in that hollow position. If he pulls his rib cage down, he's locked in all the way up. If he starts to relax and lets this arch, then he's going to start losing that position here, and he's going to start compensating, and that's going to lead to injuries, shoulders, wrists, back, all the places we don't want to have injuries. Okay? So that's how we're going to take care of your thoracic spine and increase your rotation. We're going to get into rotation more in the coming weeks, but especially flexion and extension. Thanks for watching Technique Tuesday.